What up, sports fans? Ready for another installment of Ancient Medicine? Well, I hope you are because you're listening to this. So if you're not, this one's rated G for gnarly. Buckle up. We're talking about ancient surgery. So if blood and guts is a little hinky for you, mix yourself a responsible substance, get yourself in a nice relaxed position, edit your family members as best you can, and get ready for some stuff. Before we dive in, though, we've got to talk about our author for this section. So I'm having you read just a little bit of a work in Latin by a guy named Aulus Cornelius Celsus. Aulus we're not sure about, actually. We don't know a lot about this author, including his first name. Aulus is a late Scribes edition, so maybe. He's writing before 47-ish BCE, so early-ish first century. He is a Roman. He's writing in Latin like Pliny the Elder, and that's part of why we still have him, because he's writing about surgery, which should be Galen territory. But in Latin-speaking parts of the world after the decentralization of the Roman Empire, so we're talking 400s and ahead, anyone in a Latin-speaking context would have kept Celsus around because it's accessible to people who haven't learned ancient Greek. And that's going to be the Western Mediterranean, Europe, Britain, and also the Latin-speaking church in those areas. The early stages of this was all recorded in ecclesiastical contexts. In the Eastern Mediterranean, places where people were Orthodox, were regularly speaking Greek, not as an academic language, but as a functional language. And also in the Arabic-speaking universities that later became a part of the Eastern Mediterranean, North Africa, into the old Parthian Empire. Not coincidentally, this is a major responsible factor for preserving Galen, because ancient Greek was still spoken in the early universities founded under various Islamic rulers. Galen sticks around really well in the Islamic tradition and Arab language sources too. It gets into translation and then it's good to go. The same kind of situation keeps Celsus around in the Western Mediterranean and Europe. Eventually just Europe, because of course Spain was under Arab-speaking rule for quite some time. Anyway, I digress. Celsus was useful for two reasons, only one of which is the Latin. He also gives step-by-step descriptions of how to do various surgeries, arranged from head to foot, roughly speaking. And that makes for a very useful how-to surgery manual, which is how it was used for large portions of the Middle Ages, early modern periods. Some procedures we still do have their roots in Celsus's basic methods. So he's a super influential guy for a lot of the same reasons Pliny the Elder is influential and copied and kept around. Just Pliny's more for pharmacy. Now, Celsus did write about pharmacy and diet and regimen. I'm just having you read bits of books 7 and 8 where he talks about surgery and bone setting. Now, for this section, I'm also having you read the earlier Hippocratic treatise on fractures. Actually going out of chronological order there, aren't I? So the Hippocratic treatise is earlier, that lays the foundation for Celsus's work. Celsus cites a lot of Alexandrian authors. For instance, he's our best source on Erasistratus and Herophilus, specifically their relationship to vivisection and dissection on humans. In fact, he's our only source outside of Tertullian, who is late and has an agenda. Celsus may or may not have practiced medicine. If he did, likely it was in his capacity as Roman head of household, as pater familias. He had other volumes in his collected works. We're missing them now. The only thing that survives is his how-to medicine. The De Medicina, it means about medicine, but I like how-to medicine. He also wrote How to Agriculture, how to do tactics, how to rhetoric, how to farm. But that's the same thing as agriculture. I think there's was an engineering book too. So this guy is a polymath. He's really well read. He's into both the sciences and the humanities. Seems like my kind of guy. And especially compared to Pliny, he's relatively Greek friendly. His xenophobia index is much lower. There's a lot to love about Celsus, and if you read basic Latin, you might be able to make some sense of his text in Latin. Some of it, maybe not. Just, if you're feeling lonely for school and you read Latin, have at it. But I've given it to you in English. Luckily, it's on the internet, so I didn't even have to scan it. But I have given you a PDF just to make it easier to follow along, and I've excerpted it a bit so there's not quite so much. A word about the activity key to this unit, should you decide to do it as one of your 2 activities for this course. This is the medical illustration activity with a variant for those of you who don't do illustrations for whatever reason. In that case, you can compare a Celsus procedure to how we do it today. And if you want to talk a little bit about the challenges and the benefits and the drawbacks of describing surgery without images, go for it. That's awesome. But if you can even draw a little bit, I'd like you to take a run at this. This would have been one of your projects, another artsy thing, kind of like the Temple of Asclepius. And I don't want you to do it because you're amazing at art. Like, I'm not grading you on the quality of art here. Rather, it's a really interesting exercise to try to take text and then visualize what's being described. What is the procedure? In order to do it, you're going to have to know a little bit about medical instruments from the Roman world, which is what this lecture is for. But you're also going to have to make some guesses, because it's not always going to be obvious what Celsus is telling you to do. Those places are interesting. They're nifty, they're cool. When you come to these places, what I'd like you to do is make an educated guess, just try to solve the problem. I'm not grading you on how good your solution is. And then talk a little bit about what's confusing. Where are you stuck? Why did you get stuck there? And that's all I'm asking you to do. So this isn't something where I'm grading you on how right I think you are or how beautiful your art is. Although if it's beautiful, I collect it, I keep it, I put it on my wall when I'm allowed in my office. I also have some at home because I just love student art. I think it's just the niftiest thing. I myself, I can't draw, but I'm a fiber artist and a musician, so I love art. So make me something. Like, seriously, this one is one that if you do it, I'm going to be happy. Anyway, is that everything I need to tell you to go forward? Yeah, I think so. If you have questions, let me know. The instructions are up on Blackboard. Without any further ado then, let's dive in. These are reproduction medical instruments, and I'm showing them to you first because when we excavate these, they're 2,000 years old and they're often broken. Medical instruments don't tend to get left behind in their whole form, because if they're still useful, then you're going to give them to your colleagues when you die. There are exceptions to this. Dedications at temples, you don't give the gods a bad medical instrument, right? You give them a nice scalpel. But sometimes you also give them a cheap scalpel because you don't, like, you pay a lot for a medical instrument in antiquity. They're handmade. There's no mass production. So when you're investing in one of these kits, that's a major thing. So some of the votive medical instruments are a little shoddily made. Sometimes we find it buried in a grave. But even with durable materials like bronze and silver, 2,000 years is 2,000 years, guys. Things get squished, they get broken, they get misidentified, they get misfiled. For all of these reasons, the artifacts we're going to look at are going to be a little rough and beat up. So here are reproductions that are made from looking at an aggregate of surviving medical instruments and trying to fill in what we think they should look like. This is informed not just by the finds themselves, but also descriptions of medical instruments in written literature. And this is something that medical historians' career consists entirely of. For instance, Bliquet is the standard reference I'm using for all of my interpretation, and his career is, hi kitty, this is Scipio. He's 21. Isn't he fuzzy? Yeah, and I let him sit on me whenever he wants. It's a thing. Without any further ado then, let me take you on a tour of this medical instrument collection, and I'm going to use the righty tool to do so. All right, we're starting right here with this here doohickey. I'll give you a minute to guess. Okay, this is a bone saw for smaller bones. You'd need a larger bone to cut through a femur, but for arm bones, so humerus, radius, ulna, any kind of amputation work that's not for the large bones, like the femur, even the tibia, this might not be up to the task. However, amputations in the leg area are riskier. It's harder to get a good result. The blood vessels are slightly larger. You can bleed out more easily. It's risky legs. But arm amputations are a bit more doable. The bleed out risk is still there though. So if while in quarantine one of your friends needs an arm amputated, that is a go to the hospital kind of situation. You want professional help with this. In fact, all of this stuff, like, don't try this on your roommate. I know, like, quarantine is stressful and you're probably having a lot of feelings right now, but practicing ancient surgery on them, like, even for your project, don't. Even if it would be really cool. So, that's a bone saw for complete amputation. This isn't the kind of bone saw you're going to use to remove slivers of bone or to go in and flick out tumors or to deal with necrotic damage. You can tell I've been playing a lot of D&D on Discord. Sorry. Rather, this is amputation specific. Now, all of these medical instruments, you'll notice, are kind of like a nice mellowy gold color, except for the blades. And one of the retractors, we'll get to the retractors in a minute, this is correct. Most medical instruments are made out of bronze. This is partly because bronze is practical. It's widely available in the Mediterranean, and it creates a good marriage between durability and rust resistance. Bronze will get a little bit of verdigris patina on it, but it won't rust. And that's also helped with survival too. Bronze holds up really well. It'll turn stuff in the grave with it green, but the main body of metal stays integrated, even if it's sitting in seawater, which is why for naval applications, bronze is still preferred. Now, this is accidentally genius because, as some of you are fully aware, copper, even copper and alloy, sometimes especially copper and alloy, is antimicrobial. Now, this isn't like an instant sterilization thing, so like don't go out and, you know, use bronze to protect yourself from disease. But within 4 hours, microbes of all kinds, including mold spores, bacteria, viruses, anything, through a variety of mechanisms that I'm not going to get into, but if you Google it, it'll explain it better than I can. Bronze self-cleans. You do still have to like clean glurk off of it, but the microbes that cause disease can't live on bronze for very long, which means that bronze instruments are cleaner than you think they're going to be. Now, ancient people didn't quite realize this, but they did notice, it seems, that you have better outcome with bronze instruments. And they knew that copper in solution in pharmacy was good for infected wounds. They would call it inflamed wound because that's what an infection looks like, is the skin puffs up, there's pus coming out of it. They realized early on that copper and copper byproducts, copper verdigris, the rust that comes off of copper, and also byproducts that come out of copper mining, like I'm thinking arsenic and its compounds, keep wounds from becoming diseased. So if you're in a field of medicine that is all about making wounds and cleaning up wounds, then you're going to make the leap to thinking, okay, like bronze, we're going to put bronze in the wounds. Now, the second most common material we find these things made out of is silver, which is also a really great choice. Not as good as bronze, interestingly. Silver has to be in contact with moisture in order to have an antimicrobial effect, but it is a pretty powerful antimicrobial effect. It seems that silver was the metal of choice for fancy physicians, because silver is a prestige metal, bronze is a little less prestigious. It's a very functional, utilitarian metal in the ancient world. The silver's pretty. So if you're just an extra doctor, silver's a go-to. But again, it's not a bad choice because, if you're making touch plates for doors out of silver, it's not as good as bronze. But if it's in the presence of moisture, including body fluids, it's going to be antimicrobial. Most of the time, your surgical application is going to get damp and squishy. So silver's a good choice. Now, the exception to both of these usages is blades that need to be able to cut. So if you look back at our bone saw, there are two rivets holding the blade onto the handle. The handle is copper, and the blade is made out of steel. Steel was available in Roman times. It was first imported from the Alps, later from other mining areas, but the Alps is the really good place to get steel production because there's a long history of iron mining and processing and steel making in the region. According to our ancient sources, the best, if you wanted like the really good steel, was from the province of Noricum, which is partly in modern Switzerland and Austria. And this was valued for its usefulness over time, its ability to hold an edge, and its durability under frequent heating and cooling, which is important because, and here's the saving grace. Okay, so steel is not antimicrobial. Steel will hold microbes in the little grooves of its surface microscopically. So steel instruments are only sterile if they are heated. So it may please you to know that Roman surgeons routinely would heat their medical instruments up when they intended to make a cut, and not always by any means. If you were going to say bleed someone, then you wouldn't heat your knife because you're trying to make them bleed. The reason you heat is for cautery. So one of the ways that they would control bleeding is using this phenomenon that happens when you cut with a hot blade. We still do this with lasers today in laser knife surgery. If you use a hot enough blade, it will burn the tissue as you cut, and this causes the flesh to cook, sear, and then form a scab. This stops bleeding, and the effect lasts for 8 days. Now, this is the problem with cautery, and this is why just like heating up a hot poker and sticking it in somebody's arrow wound is not always a bright way to handle an arrow wound. Try telling Hollywood that, but not a good idea. Because after that 8-day period, the scab is going to slough off and it's going to break up. If it ends up in the bloodstream, it can cause an embolus. If you've closed the wound over that burnt area, it's going to start bleeding internally. It just delays the bleeding out. Now, on a small wound, that's long enough for the blood vessels to shrink up, for bleeding to limit itself, and for the wound to have a good chance at healing. But you can't use cautery alone to stop major severed blood vessel bleeding. For that, you need ligatures. We're not there yet, but it's coming. It's coming, folks. I explain all of this uh, just to give you an idea of how not sucky Roman surgery is in a lot of ways. Now, anesthesia is still in its infancy. Regular doses, reliable, repeatable doses are hard to get because of the situation going on in pharmacy. There is no ether. General anesthetic is just a pipe dream at this point. In fact, so are pipes. This means that surgery has to be really, really fast. And it's the first thing Celsus tells you in his introduction. He says, okay, like, how do you know who's the ideal candidate for a surgeon? He says, well, you have to be young and strong because it takes a lot of upper body strength to do surgery. True. Modern surgeons today have to have stamina and have to have strength because you do have to get quite rough with the body for certain surgical procedures, bone setting especially, but you also have to be very precise. So you need strength that is also completely within your control. And the next thing he says is, okay, you can't be a total sadist. You need to be able to manage your patient's pain. However, you can't be so caught up in your patient's pain that you don't proceed. You need to be able to ignore the screams, focus, and get it done. This is the case for all surgery before the invention of ether. Even slightly after the invention of ether, some medical ethicists thought that ether was unethical because it subverts the natural order. They especially thought it was unethical in childbirth because pain in childbirth is the curse of Eve, and if you turn that off, you're letting women evade their responsibility. Oh, bless your hearts, 19th century gynecologists. Some real special people out there. Although, if you want to read about one guy who wasn't a total dipshit in the early years of anesthetic surgery, look up Dr. Mutter. He's this guy out of Philadelphia. His collection is still a museum today, and he is the boss. However, that's the 19th century. Okay, one more 19th century story just because this is fun. There was this surgeon in Edinburgh in Scotland named Dr. Liston, and he had the dubious distinction, not really dubious, his other distinction is dubious. He had the distinction of being the fastest knife in surgery. This is in the early 1800s. And he used to have his med students time him when he did surgery. This is back when medical schools would regularly perform surgery in theaters so people could come and watch. This whole performative medicine thing doesn't tie with Galen, and it really becomes trendy in the 1800s. So he'd be like, time me, and then he could do an amputation in under 2 minutes was his claim to fame. Now, I did say dubious distinction. He wins another award in medical history, and that is the highest mortality rate from a single surgery. Because during one amputation, he removed the limb, he accidentally cut his assistant, and somebody who was watching dropped dead from some kind of cardiac event. His assistant died from an infection in the wound. So I think gas gangrene. Assistant died from gas gangrene, and because of cross infection, so did the patient. So the patient died, the assistant died, and one of the audience member died. So it was a 300% mortality rate from a single surgery. Well done, Robert Liston. You're the winner. Good job. Gold star. Sorry, I shouldn't make fun. I don't know how fast my amputations are, nor am I going to try, no matter how annoying Mr. Spouse gets. He's not that annoying. He just made me dinner. He can live. Right. That's a bone saw, and the really long explanation of the bone saw. Right next to it, do you see this long... Oh, one other thing about the bone saw. Sorry, I'm not done. We've only been talking about the saw end. If you look on the other end, there's this hooked formation. It doesn't show very well in this photograph, but on the inner edge of the curve, there are little teeth imprinted into the bronze. That's because this is a two-headed bone saw. So on the one end is the saw, on the other end is a bone lever. So you use the one end to saw, you flip it, and use the other end to lever out any bone fragments or pieces that you need to dislodge. And this is true for most of the medical instruments you're looking at here that are used in surgery. And this is because you have to move fast. You don't have a lot of time to put down, pick up, put down, pick up. So instead of put down, pick up, you flip and use the other end. So these are dual purpose medical instruments to speed up your operating time. That, at this point in surgery, is a life-saving innovation. This isn't just about saving your patient from pain, but also from shock. You can traumatize someone to death, and one way to do that is cutting off bits of them while they're awake and aware, no matter how much opium you've had. Next instrument. This is another double-ended one, although it's not as obvious. On one end is a bone lever or retractor. So you use that scooped edge that's a little sharp on the leading edge of the claw. It's helped somewhat by my gesturing. This takes the edge of a wound. Sorry, my laptop is on my knees here. So say this is a wound, and we'll do it this way. It pulls the edge of the wound back and then holds it. And then your assistant can hold it open while you operate in here. On the other end, you'll see that it's a little bit pointed, but in a blunt way. That's a probe. And both of these are necessary in similar operations. You use the retractor to pull back the edges and look. You use the probe to push down into the wound and feel. Especially in ancient surgery, light sources aren't great, and you need to be able to use touch as well as sight to figure out what's going on in the wound, but putting your finger down in there isn't going to result in good outcomes, although sometimes that does seem to be how ancient surgeons did it. But it seems the most normal way to reach into a wound, and we know this from Kelsis's description and Galen's as well, is not to use your hand, but to use a probe. And thank goodness, yeah? Probes are much safer because they're not going to carry as many germs. It doesn't have your under the fingernail gunk. It's safer for reasons that they didn't quite understand, but they did realize that outcomes are better if you're not touching the wound so much, and definitely not touching deep into the wound. The deeper that you put outside microbes into a wound, the more potential you have for hidden and devastating infections. This is why it's not always a good idea to sew a wound closed immediately, because you create a pocket of traumatized flesh with bacteria that you have now sealed off. So any poultices or cleaning or debridement that you're doing at the surface of the wound doesn't get down to the lowest level of infection, and this causes life-threatening complications. So this is another bit of good news from ancient surgery. Ancient surgery gets a bad rap, guys, but there's a lot they're doing right in this period. And you know what? That makes me happy, because most of what I study is just horrifyingly wrong. Okay, so that is our retractor. Now we're looking at this here doohickey. This, folks, is an arterial hook. Why, Dr. Jones-Lewis, why do we need to hook an artery? Glad you asked. When an artery is cut, it doesn't just stay there like a broken pipe spurting blood out. This might be one of the reasons why it took us so long to figure out that arteries pump blood away from the heart. Rather, arteries are muscle tissue, yeah? And they have to be particularly tough muscle tissue to withstand the pumping of the heart. So when they're cut, veins do this too. They retract, they pull back, because the tension is taken off of the blood vessel, and then it shrinks back up into the wound. And this is why it's difficult to stop bleeding, because the thing that's bleeding isn't going to be right at the surface where it's cut and obvious. It's going to be back in the flesh a little bit. So you're going to have to go fish to find the bleeder, and you're going to have to do it right quick, because none of that blood is going back in the body because there are no hypodermic needles or blood types. Probably for good reasons. Not probably, yes, for good reasons. You'll notice that the hook on this is very, very sharp. You use the other end of it, the probe end, the handle end, to kind of feel in where the tract is that the artery has gone down if you really need to find it, but more likely you just have to know where the artery is likely to be, follow the trail of blood, reach in with the hook and try to snag the severed end of the artery on the end of the hook. Then you twist the artery and that shuts off the blood quickly. And then you leave the hook in it while you operate on the rest of the wound. You're going to need a couple of these, most likely, but you can leave them there while you work. This buys you time to do what you need to do. And then at the end, you tie the artery off either with a piece of cured intestine thread, so gut, which is useful in surgery, especially for internal sutures, because it doesn't irritate the flesh a lot, it does dissolve over time, but it's not exactly clean always, although you do have to boil it as part of the making process. So the other things we see used are silk and linen. Silk, by the time of Galen and Celsus as well, had become readily available in the Mediterranean, and had been for the past 100 years or so, even earlier still. Wild silk from India was available as early as the Bronze Age. Not in huge quantities, because wild silk doesn't produce massive quantities, but decent enough that wealthy people had access. By the time we get into the 1st century BCE in the city of Rome, say, there's enough that if you're a fancy surgeon, you can get silk. The Silk Roads to China are fully open and running by the time we get into the 1st century CE. They're open enough that there's an embassy from the Emperor of China to the Emperor of Rome in the mid 2nd century CE under, I think, Antoninus Pius. Galen's go-to is silk, and silk is a good choice. It's very, very small. It's tough. It ties well, it slides well, and it doesn't tend to irritate the flesh much. It makes nice, tiny, but strong stitches. But absent that, linen also gets used. Linen is a good choice for all of the reasons we talked about in Pharmacy Week. It doesn't absorb liquids very well. It doesn't hold on to particulates, so it's easier to clean. It's more likely to stay clean, but it is tough. Your body is going to try to spit it out eventually. But if all you've got is linen, linen's a decent choice. It's certainly better than cotton. Also available, I want to make sure I mention this, was surgical glue, which might be a little surprising to you guys, but hey, more good news. It was made from the swim bladders of Baltic sturgeon, and when boiled and prepared, it produces a material called isinglass that can make essentially crazy glue, an early organic crazy glue. And because it's made from fish, it'll dissolve in time, and it dries even in wet conditions. So this was used to close wounds the same way that we use glue today sometimes to close wounds, but also it was used to glue bone splinters back into place, and because it's organic, it's just fish material, it'll slowly dissolve as the bone heals to repair the patch, which is pretty darn awesome, actually. Like, that gives me great joy on a number of levels. Okay, We're on to our next, moving left to right. These ones here, what is this slide trying to do? Are two different kinds of scalpels. These are the most common scalpels used in the ancient Mediterranean. And you notice at one end there's this kind of leaf-shaped blunt surface, and on the other end there's a blade, and they're very close together. That's on purpose. It's a probe on one side and a blade on the other, so you can cut, check, cut, check. If you're trying to remove something, the back end of the scalpel is what you use to kind of feel around and be like, okay, did I get all the fragments? And then the blade end lets you widen the wound further. The cutting surface is made out of steel, same way as the saw blades, and the body is made out of bronze. And the different shapes depend on what kind of procedure. Celsus is going to refer to both of these. The very sharp one is the regular knife scalpel. Sometimes he'll say it's the sharp scalpel. We think it might also be the beaked scalpel he mentions sometimes, but there's another even rarer kind of scalpel shape that looks a little bit like a crow beak. It's sort of hooked. We're not 100% sure what Celsus is talking about there, but it might be this thing. So this is the very, very pointy one. This is used to lance infections, to drain things, to cut deep and sharply into an area. This kind of long, pointy blade does a really good job at cutting deep and long. Contrasted to the one next to it, which has a couple of names. Sometimes it's called the bellied scalpel because it looks like somebody's beer belly. It's also called the breast-shaped scalpel because to some ancient surgeons this looked like a boob. Sometimes classier historians will call it the D scalpel or the D-shaped blade because it looks like a blade. I think we can say boob. It's fine. Whatever helps you remember it is okay. I think I used bellied scalpel on the final. At any rate, this round and shallower curve is used to make shallow, delicate cuts and also to create curved lines rather than straight lines. And it lets you do a little bit more delicate work. Some of them have a little peak in the middle of the blade where the nipple would be, and that would have been used for very shallow lancing of surface infections. But both of these get regular rotation, and they look a lot like modern scalpels. Like if you're familiar with modern operating equipment, this is going to look real familiar to you. These are classics. They don't change much because they work. Okay, so now we're going to move on to a more alarming member of our lineup. This one right here. I am so sorry about this, folks. We're going to talk about eyeballs, and we're going to do it again later. So if you need a moment for eyeballs, now would be the time to pause. If you get super skeeved out by eyeballs, maybe like skip a minute ahead. I'll try to make this quick. This is a couching needle, and it's used to do ocular surgery, so surgery inside the eye. You use it to poke through the outer layers of the structures of the eyeball in order to remove the lens and push it down in cataract surgery. I'll explain how later. I think I forgot to say this on the first page. The procedures that you can pick to illustrate are procedures I don't describe in this PowerPoint because otherwise, what's the point? I've told you how to do it. You'll have plenty to choose from. I just picked my favorites. At any rate, that's what that's for. It's for eyeballs. Not just eyeballs, though. It could be used to pop smaller infected areas, to open up constrictions, but mostly that's eye surgery. And we find a lot of them because eye surgeons were one of the most popular go-to surgical specialties in the ancient world. It's a great way to have a practice, apparently. There were a lot of them. In Latin, it's ocularius, and eye doctor. In Greek, it's ophthalmologos, I think, where we get ophthalmology from. Okay, away from the eyeballs now. On to our next contender here. Forceps. No surprises here, but what is really nifty about this particular pair of forceps is that there is a collar. Do you see this sliding ring about halfway up? That there? That's a sliding ring, a little bit like we still have on salad tongs. Some forms of surgical forceps still have a version of this. You use this to choke up on the blades to have them hold even when you take your hand away, which is really important. Like if you want to clamp something off and leave it, if you want to clamp a structure and then move it outside of the wound and then let gravity kind of hold it in place, you can use this for that. And when you need to take pressure off, you slide back the collar and it comes right off. It's a one-handed on, one-handed off structure. This could be used to remove things, although we find things that look a little bit more like needle nose forceps for that kind of delicate work. This is more for clamp and hold rather than pluck and pull. Next to it are two examples of the same medical instrument. I'm going to just draw a little half circle around them here and here. We have long and short, the snaky S-shaped one, and the short, slightly curved at the top one. Again, both bronze. These are tubes, like metal straws. I'll give you a minute to imagine. These are urinary catheters. The long S-shaped one is made for a urethra that goes through a penis, which is why it's got that bending curve, is that the urethra takes an S curve through the body, so the catheter needs to be that shape. The straighter one fits the no penis model of, what's the word I'm looking for? Urethras. This is one of the few areas in which having uterus model reproductive system is working in your favor, because your urethra is a lot less complicated. Things can get in and get out. Well, get out mostly. Let's hope mostly get out. Of course, that's the other problem, isn't it? Things can get in, hence urinary tract infections. There's some suggestion they might not have happened as much in the ancient world because they might have something to do with modern hygienic practices. I'm not going to get into it. It's neither here nor there. Now, the male catheter would have been in use much more frequently because a urethra that doesn't go straight is much more liable to get stones stuck in it. This is one of the reasons why bladder stones tend to be much more complicated and much more painful in men than in women, although we can both get them. It's not an either or, but the other reason that you'll need more of your penis compatible catheters than your no penis catheters in this culture, and shouldn't be too normative here because it's different in cultures that have certain kinds of eunuchs, but not here. Eunuchs in the ancient Mediterranean keep their penis, so if you're born with a penis, you probably kept it in the ancient world. Ancient Mediterranean world. Sorry, ancient China. This is inserted in order to bypass also a swollen prostate. So if you have obstruction to the bladder because of prostate issues, you'd use this as well. One other reason why you would need to insert a rigid catheter is complications of STIs, and not just sexually transmitted infections, but infections in general. One of the major complications that comes from having an untreated infection in your urethra is that your urethra will develop points of constriction. Scar tissue will develop in response to the infection. The scar tissue will cause shrinkage, and this can cause blockages to the passage of urine through your urethra. A way that you deal with that is by putting the catheter up into the urethra in order to stretch it back out. we still do this sometimes. As antibiotic resistance becomes a thing, we may see it come back. If you're interested in the history of this, Google image yourself bougie, Bougie, I think, not in the sense like bourgeois bougie. This is a medical instrument called a bougie. These were made out of various substances, including like wax, arsenic-laden clay, like, a lot of options, but bronze ones too. Silver was also very popular for this. And this was in heavy use in the 17 and 1800s in response to an epidemic of gonorrhea. Untreated gonorrhea causes a lot of constriction in your urethra, and you're going to need some kind of a rigid item to reopen the passage so your urine can go out where it belongs. So these humble-looking tube objects, cringeworthy as they are, save lives. One little detail that is hard to see here, but I'm going to point it out a bit. Up at the top here, many, not all, but many models have a little hole in the side of the tube rather on the end of the tube, and that's clever because if it's just a straight tube with an opening on one end and an opening on the other, if you push it up into a bladder that has a lot of sandy deposits, you're just going to get sandy deposits stuck in the tube. Think about like pushing a straw into a Slurpee, how the ice will plug it up still. So if there's a hole on the side, that creates a little roof so that as you're inserting the catheter into a sand-filled bladder, then the hole on the side won't get as obstructed with sand. The little hat on the top will protect it as it's coming up into the bladder space, and then when it gets to the urine can proceed out unobstructed. That's a nice feature. Sometimes you'll also see an angled cut in the end you're inserting. This also makes it a little bit more comfortable. A little bit. This isn't going to be comfortable, but if you've got an obstructed bladder, you're going to be ready for it. Finally, we're moving to the top of the image. I'm going to talk a little bit more about spatula probes on the next slide, so I'm not going to get into this too much. But we do have a set of tweezers. Now, tweezers are ambiguous because the same tweezers are used both in cosmetics and in surgery. And there's kind of a fuzzy line between cosmetics and surgery and pharmacy anyway. These could just be cosmetic tweezers, or they could be used to take splinters out. In the same way that you've probably used your eyebrow tweezers to take splinters out. They're wonderful splinter removers. Finally, we find often in medical deposits these tube things. These are storage cases for small medical instruments like needles for eye surgery or just needles for suturing and sewing. Pins for wound closures. We'll be looking at one of those in a minute. And other small bits of metal stuff that you'll be using. Okay, that's our tour part 1 of the doctor's surgical kit. Let's go to part 2. Part 2. Oh, this one's fun. I mentioned that you need a bigger saw for a femur. Hey, look, it's a bigger saw. Turn on my, there we go, there's my marker. There he is. This particular one has a bronze blade. And although that would have been in need of sharpening more frequently, it also would have led to better outcomes. When you're dealing with larger bones like femurs, even a humerus you might use this on too, you're dealing with a bone that has a lot of marrow tissue. Bone, as we've mentioned earlier, isn't entirely solid. You have a solid outer layer. There's kind of a spongy, airy quality to the middle of the bone tissue. It hardens again, and then at the middle you have the marrow, which is very gooey and fatty. It's where various bits of your blood is made, so it needs to be in good working shape. In fact, one of the early symptoms of radium poisoning is that first your blood marrow overproduces, so it's very, very um, active, and then it loses its ability to produce red corpuscles at all, so you get like desperately anemic, and you can tell when you look at the marrow because the marrow is um, the wrong color red and not as fatty. Not that that's either here nor there, because nobody has radium poisoning in ancient Rome, but radium poisoning is really interesting, guys. If you're sick of thinking about like pandemics, radium poisoning, Google Radium Girls and treat yourself to Kate Moore. Great book. At any rate, large bone saw right there. I mentioned earlier the crowbeak scalpel. Here's one possibility. This might be a crow's beak scalpel. Then again, it might not be. We're not sure, but we found them. Maybe. At any rate, here it is. And for convenience sake, I'm going to call it a crow's beak scalpel. But I'm putting like, think we're about 75% sure that's what this is right now. Next to it is a delightful medical instrument. And full disclosure, this is one that kind of like creeps me out. Like, you may have noticed, I have a strong stomach, guys, yeah? But there are a few things that do make me cringe, and this is one of them. Check out the tooth forceps. This is curved in order to provide traction when grabbing a molar, and so that as you're pulling out, it'll create a motion that goes this way and not straight up, because if you're going straight up or straight down, you're going to hit yourself in the opposite row of teeth. You don't want to do that, but you also don't want too severe of an angle because you can break the bone of the side of your jaw by snapping the tooth sideways. Oh God. Sorry, I'm having a bit of a Victorians did this wrong, and it was horrifying. This is not quite as horrifying. We'll talk about why we need to be able to do this later, though, so steel yourself for some dentistry. Dentistry adjacent, we have this bad boy. This is a uvula or tonsil forcep. I'm going to explain why we need a specific set of forceps for the uvula/tonsils in more detail later, but I do want to point out how this looks a lot like your average forceps, right? You've got two arms, it works like a set of needle nose pliers, it works exactly like you think it will. The difference is in the blades. So these aren't straight up blades, but they're also not just a straight up plier tooth. So kind of imagine the pliers you've got in your toolbox right now, assuming you have a toolbox. The teeth are all of one piece with the arm, but here the arms are thick, but the teeth have been cut back into the bronze a bit. We're looking at them straight on the hollowed out edge. We'll look at these in a little bit more detail as we talk about the procedure that they're designed to address. But that's how you know you're looking at them, is that not only do you have like little rasp teeth and it looks like pliers, but one side of the rasp teeth are recessed a little bit so that when you grasp with these pliers, here my little finger pliers, on one side the grip is like here, but on the reverse side the grip is still here, back a little bit. That'll be important later. Next to it, right here, is a cautery iron, which is exactly what it sounds like. You heat it up and you apply it, and then it burns whatever bit of flesh you're putting it on. I talked us through cautery a bit, so I'm not going to reiterate too much. This specific design The curve allows you to set it in a FAR without directly putting the handle over the FAR, but you still would need gloves to pick this up. Like, don't just reach over and pick it up because the whole thing is going to get hot. But the flat bit on the end right here is the business end. That's what you're applying to the flesh. And you're not always doing it to a wound. Cautery was used to create scars that would pull the skin tight in certain areas, and this was used for therapeutic effect. It was also used to burn and disable underlying structures. In veterinary medicine, sometimes this was used to neuter male animals. They would use heat as well as pressure to crush and damage testicular tissue without cutting into the skin, and this reduced infection rates. There are other ways to castrate animals too, but I'm gonna leave that one there. If you're really super interested, I have a working paper that's Googleable, but I'll spare you for once. Right next to it is a disassembled example of a medical instrument we'll be talking about a little bit later. So it's right here. This is a bow drill trepanation blade, and this is used to cut circular holes into bone, most frequently the skull bone. This one's a lifesaver, and this one is one of the first surgical procedures that most human societies invent. We find it popping up independently all over the world. It seems as soon as humans figure out what skulls are for, they figure out how to drill holes in them. It's not as horrible an idea as you might think, but this particular one is clever because the part that runs the blade, so there's a knob here, this wooden area, is for the string to wrap around, and then this armature clicks together so it's a much longer piece, and you work it like a saw blade back and forth. So kind of imagine a violin bow, only the hairs are really loose and they're wrapped around a knob so that as you move the bow back and forth, the knob rotates. And that's what cuts a circular hole in your patient's skull. That's where we're going with this. I told you I'd talk about spatula probes. Here they are. Behold the spatula probes. I'm not going to spend a ton of time on these, or at least I'm going to try not to. But I do want to point out a couple interesting ones, and also basic types. This kind of shape here, this long oval, you'll hear called an olivary spatula probe sometimes because it looks like an olive leaf, hence olivary probe. Sometimes you'll also get this shape. Sometimes they'll call it a knife probe. That shape can be quite sharp, and it can be used to cut as well as to apply medication. You'll notice most, if not all of these, have a blunted or shaped end to them. That's the probe end. So you've got the spatula on one end. The spatula applies medication. Sometimes it can also widen a wound a little bit. Some of these do seem to have a cutting function, but most of them are just blunt. The longer ones are for probing larger areas, applying medication, reaching into bottles and getting medications out too. And then the probe ends are strictly probes, although sometimes in cosmetics they're used to dip in and get a little amount of, say, eyeliner, and then that's what you use to apply your eyeliner. That still how we apply eyeliner, for that matter. We have felt tips, but essentially we're taking a long pointed object, dipping it in a solution, and then those of you who can do a reliable flick, which I cannot. I've been practicing in quarantine and it's just still not coming out. I've mentioned spoon probes, so I'm not going to belabor this one, but here are a few more examples. They're big, they're small, all kinds. But there is one we haven't talked about much. This one right here. You can see several examples of it. Like here's one here. There's another one here. That one. These are ear probe scoops. and they are both cosmetic and surgical. So they're used by surgeons to remove obstructions from ear canals and noses, anything from like objects that are lodged up in your sinuses or earwax that's built up and has occluded the canal. This helps you get out earwax crusts and then drain pus off of an infected ear. These are useful. They're blunted a bit to make it harder to pierce the eardrum. However, you probably shouldn't use one of these yourself. You can buy them, but they're not a great idea because it's really easy to puncture your own eardrum. You can do it with a Q-tip. And you're not supposed to use Q-tips, but I can't stand the feeling of my own earwax, so confession time. I use Q-tips. I shouldn't. I live dangerously. I'm a badass. That's not a badass. It's unsafe. Do as I say, not as I do. But yeah, I, however, do not use ear scoops. Even a rebel like me won't go that far. Oh gosh. At any rate, these are used by regular people in the same way that regular people use Q-tips. Q-tips have medical uses. They also have non-medical uses, including cleaning out ear canals. And most Romans would own one of these, or at least a family would own one, and you just use it to get the gunk out of your ear and keep it looking nice and uncrusty. And it's also a useful thing to have around if you have kids. Kids love sticking stuff up their noses, and it's good to be able to get that stuff out sooner rather than later. Let's see, anything else I wanted to say here? Nah, that about covers it. This is just a tiny sampling. We find so many of these guys, so many. And it's not because there were a ton of doctors in the ancient Mediterranean. There were, but not like per capita any more than we have, I don't think, as much as we can tell these things without good demographic data. Rather, everybody needed at least one set of these because they were using it for cosmetics, for cooking, for small recipe, for spice measuring, for taking perfume out of bottles, for basic grooming functions. And most people owned their own. These we find in silver a lot because of that. If you're a fancy person, you're going to want fancy tools if you can afford them. If not, you get them out of bronze. But they're durable. And this is one way in which Romans are creating a relatively sustainable solution to something that we don't have a sustainable version of. And a lot of our cosmetics applicators are throwaway items that aren't made for the long haul. And it's not because stuff made to apply your makeup over the long haul is necessarily unsafe. If we were willing to invest in bronze makeup applicators, maybe they'd last longer? I don't know. This is coming off judgy. Let's go to the next slide. Oh, Past Me did remember to give you up-close pictures of a scoop probe, and here it is. This is what I was talking about with the ear scoop. This one's really nice. Somebody got super fancy and engraved this little design into the handle. Likely this was either a fancy doctor or this is somebody's cosmetic scoop, but we can't tell the difference because they look the same. Now this wasn't just for getting stuff out of your ears. If you were also using one of these long, tall bottles of oil-based remedies or ingredients to medications, this is what you'd use to measure out a tiny little bit into your recipe. It's a little bit like a measuring cup, it's a little bit like an ear cleaner. All around nice idea. Don't puncture your eardrum. Cupping jars! Oh yeah, these are fun. This brings me to one thing that is very different about the landscape of Roman surgical equipment, well, Greek and Roman and Mediterranean medical equipment, and most modern medical equipment in European-derived cultures. That is cupping jars. You may be familiar with these because they are used still in Chinese traditional medicine, and a couple other places in the world they hang around. Literally sometimes. You'll notice these have like little handles so you can hang them. Uh, as a practice, in their Roman context, here's what they're designed to do. You heat up the body of the cup, and these could be made out of all kinds of materials. Right now we're looking at a set of bronze ones because bronze survives really well. We have some glass ones, very rare, that have survived, but glass seems to have been super popular. It's just glass breaks because it's glass. There were also versions made out of silver or sometimes terracotta, although not as much. It's usually either bronze or glass. Silver, I guess, if you're fancy. When you heat up the metal, the air inside becomes less dense because that's what heated air does. Then you place it onto the skin. As the cup cools, the air inside of it contracts and creates a vacuum that then sucks your skin up into the vessel. Turn my pen on again. This is the end that's put against your skin, and this does exactly what you do when you give yourself a hickey, or your friend, however you get your hickeys. It's the same principle. Yeah, you create suction on the skin. This breaks the capillaries and causes bruising. In a humoral model of the human body, this was felt to encourage the incorrect humors, the pathological humors from deeper in the body to be pulled to the surface. And that's what they thought they were seeing, was either excess blood being lifted from the inner layers of the body to the skin where it could safely be perspired out and dissipate, or it's a nice purpley color when you do this. So I thought like this was a way of getting harmful black bile out of the way. Opinions differed. In Methodist models, this was felt to unblock constriction, encourage flow. You could put it on one side of the body when you thought there was constriction on the other side. Sometimes this was used to relieve like menstrual issues for a patient with a uterus. If there was cramping or too much bleeding in the uterus, they'd try to like divert the blood to the thighs. This is a go-to. They use these things for everything. Celsus mentions them a couple of times in the passages I've given you. I didn't give you a lot of Celsus's how-to cup. Galen is a huge fan. He'll slap them on you at the drop of a hat. Now, this isn't something that's going to hurt you too much unless you have a bleeding disorder. If you have hemophilia, this is a horrible idea. Probably sickle cell anemia, it's a bad idea. But for an able-bodied person and a person who doesn't have a bleeding disorder, this isn't bad for you. It's just not all that helpful. It's not, as far as we can tell, this doesn't seem to therapeutically do much over and above the placebo effect. Now, the placebo effect is an effect. We're still not quite sure what's going on with it. So maybe it would help a little bit, especially in an ancient context. There's so few things you can do. This isn't going to do anything actively harmful to most of your patients. So that this one I give a pass on my usual judginess. It makes sense. If you think the body's run on humors, it's not a silly way to go about your business. This was such a common therapeutic intervention that when doctors wanted to telegraph to people that they were doctors without using text, this is what they would put on their signage. And that's what we're looking at here. This is from a doctor's tombstone. This particular doctor had a practice that involved surgery, and I think it's a he. He included the two cupping vessels because people would see cupping vessels and they think, doctor. In the same way we see white coat and we're like, doctor, even though people who aren't doctors wear white coats. A lot of doctors don't wear white coats because it turns out white coats are harmful. They hold germs. Just putting that out there. So, like, if your doctor doesn't wear a white coat, that's a good thing. But, like, no judging. If you wash your white coat, it's fine. Right. What we're doing. Judginess. Okay. On the inside surface, you see a set of scalpels, retractors, and probes, including... Oh, hi, kitty. Goodbye, kitty. And that was Scipio's butt. This one right here, this one on the very end, that seems to have this double hooked sort of look to it. We'll get into that in a minute. We think we know what that is. Next to it, this in here, that has a kind of leaf blade edge on the end. It may be either a blade or a probe, probably a probe, and on the end it's got this long hook. That's candidate number 2 for crowbeak scalpel. So maybe it looks like that. Maybe it looks like that long kind of Swiss Army knife blade. It could also be both, because nothing's standardized in the ancient world. I mean, these medical instruments aren't being made by factories. There is no agreed upon convention for what you call them. Each surgeon had to order them from their local bronzesmith, and they tend to be custom jobs fitted to each individual doctor's hands. So standardization is aspirational rather than actual in the pre-modern world. But there's something to be said for that too, because standardization in some ways is great, but not in every way. You want medical equipment that fits you, and one of the things we give up when we give up small craftsman control of medical equipment is we give up customization and perfect fit and long-term quality sometimes. And I'm not saying standardization is bad, I'm just making the argument for local craftsmen. Ah, yes. On to some actual ancient tools. Now, as I said, you find scalpels from the ancient world. This is our best case scenario, by the way. The 2 scalpels labeled number 25, because that was their number in the case I found them in. This is in the Museum of Anatolian Civilizations in Ankara, Turkey. If you ever get the chance to go to Turkey, go. It is fantastic. And they have the most amazing ancient Mediterranean sites. I mean, it's amazing for other reasons too, but I like what I like. And oh my gosh, the quality of finds, the curation of the site, and most archaeological sites come with a local managed colony of cats who are very well fed and well taken care of, so they're just there for the scritches. I had this calico that let me carry her all the way through Ephesus, and it was the best day of my life. Maybe also my wedding. But it's really close to cat in an archaeological site day. It's awesome. Right, what were we talking about? Scalpels. Yes. So here are 2 examples of that bellied scalpel I was talking about. We've been looking at reproductions. Yeah, I think this is the first actual set. So here they are. These are unusual because these are the steel blades. Now, the steel blades don't look very sharp right now, yeah? They're sort of puffy and crusty. That's rust. This is the reason why, one of the reasons why steel over the long haul isn't great for a medical instrument. In order to keep this from happening, you have to constantly be sanding off and cleaning and taking care of the surface of your steel. This taking care of your steel process, coincidentally, would have helped with the cleanliness, as would the fire. Fire would remove moisture. 2 of them together would be helpful. But after 2,000 years, this is what happens to a sharp edge, is that the rust kind of poofs because rust is flaky and less dense, and the layers kind of peel back and off. This is best case scenario. Usually the blades aren't even there because they've rusted entirely away. So it's really good. You can see the original silhouette of the blade. Sorry, I get really excited because these are the best ones I've ever seen in a museum, and I was so psyched the day we found them, and I just get warm fuzzies every time I see them, so hi! The next two, these I've also seen in person when we took the Ancient Studies trip to London last year. These are from the Wellcome Museum of Medical History. If you're ever in London, look the Wellcome up. They have a mind-blowingly great history of medicine collection and also really good contemporary exhibits in medicine and the medical humanities. It's named after the Wellcome and the Burroughs Wellcome Pharmaceutical Company. He had a personal collection of medical items from all over the world that he donated to this museum that's open to the public. You don't have to pay to get in. You just have to get to London. Like, seriously, make it a priority. First day you're in London, go there. Like, don't even sleep, because it's just, it has anatomical votives, there's surgical equipment, they're like, okay, I'm calming down now. We're like deep into my fangirl territory here, so you're gonna have to forgive me. Okay, this is an actual glass and Egyptian jar. It's Egyptian, bronze jar. It's from Roman Egypt. These are both, I think, the one is what, 251, and the other one I think is also 2nd century. Is it? No, 4th century, maybe. Oh, wait, BC to 3, yeah. You can tell how uncertain we are about the date on this one. That gives you an idea of just how little this design changes. They pick a design, they stick with it. You get a lot of variation in shape, but it doesn't seem to have trends over time. And that's part of what makes it easy as a branding mechanism for doctors. In general, our symbolism tends to be conservative. So long after a thing has ceased to be used in actual practice, it'll still have usefulness as a symbol. I'm trying to think of another medical relevant one. The barber pole outside of pharmacies. Our barbers no longer do surgery in the same place they sell their drugs, and yet the white and red pole is meant to symbolize the streamers of blood from the surgery, and the white, I can't remember what that's about. The internet will know. Fact check me. Okay, we're not done with cupping quite yet. The disgustingness continues, but not for much longer. There are 2 different kinds of cupping. I've described dry cupping to you. This is when you put the cup over unbroken skin, suck the skin up into the bottle, and then create the hickey pattern. We're looking at it here in its modern form. These modern cups have rubber stoppers included on the ends. That's what these yellow things are. You can pop those out so that it's easier to release the vacuum. Ancient cups, you had to slide a probe into the edge, like right underneath there, in order to break the vacuum seal and remove the cup. If you just pull it off, you're gonna like separate the skin from the underlying tissues. It's really bad. Don't be that guy. In fact, don't do any of this unless you're game. In which case, like, go ahead. You probably won't hurt anybody. Just don't, if you do it, don't use it like a doorknob, is all I'm saying. Wet cupping is exactly the same process, except you break the skin before you put the cup on. Either you put one cut into the surface of the skin or deeper, or you do it over something that you're trying to drain. So for instance, if you have an abscess, a pocket of pus, or you have some kind of a deep-seated infection where you're trying to draw infected matter out of the skin, then you would open the skin, lay the pus pocket open, and then place this over top of it, and then the pressure of the vacuum would suck whatever is inside of that wound out. But more frequently this was used for bleeding, because one of the problems with bleeding is that your blood clots, the bleeding stops, and if you think you need to evacuate more blood, you might actually have trouble getting veins to bleed for long enough, because your body doesn't want to bleed to death. It has emergency systems in place because there's like no good excuse to bleed someone. Well, hemosiderosis is one of the few indications where bleeding actually will help, because it depletes excess iron and gets it out of the body. So if and only if you have hemosiderosis or hemochromatosis, then go for it. Otherwise, this one doesn't have any therapeutic advantage we can think of, and it can be very dangerous because it allows you to remove more blood from the body than you otherwise would. This got very extreme in the 1700s and regularly resulted in death. In ancient Greece and Rome, the descriptions of bleeding are those of much less radical bloodletting. So they're not taking out half pints at a time. Rather, they're making smaller cuts like those that our modern practitioners using. The cup goes over the skin, then the cup collects the blood inside the cup, and then you break it carefully, and this keeps the mess from going all over the place. It also speeds up the process, so the vacuum pressure keeps the blood flowing, it inhibits the ability of the wound to clot, and it also makes it go faster, so you're not getting bled for forever. However, this is a bad idea, especially if infection is involved, but it's just a bad idea because this doesn't just remove blood, this damages your tissue. This breaks capillaries, this causes disruption in the small circulation around the wound, this damages the structures that are already bringing your immune cells into the wounded area and encouraging them to fight off infection. It also causes more damaged tissue to be created, and this damaged tissue can then die, become necrotic, become infected, and then cause even worse infections to develop. This is why if your friend is bitten by a snake, you do not suck on the snake bite, because you will damage the tissue, damage your friend, likely make it worse, and also run the risk of infecting yourself with snake venom through your gums. A fact that was known in antiquity, actually, Celsus is the guy who calls bullshit on this practice. Good job, Celsus. Gold star. Now, I showed you the reproduction cautery iron. This is one of the originals that it's based off of. This one from Saskatchewan. I haven't been to Saskatchewan, so pardon me for not squeeing about their collection. But their online archive is quite nice. It gave me this lovely cautery iron. So here you go. This is what they look like. And I already told you what to do with it. Now, before we go too much farther into the world of ancient surgical procedures, I need to talk about how the body responds to wounds on a cellular level, because understanding this helps us to figure out the difference between useful and not useful procedures, and also to understand what kind of situations an ancient surgeon is going to be dealing with in wound care. Because some of the stuff they're seeing is very different from what a modern doctor in the age of antibiotics would see. Because we have antibiotics now, we can prevent or at least reduce the risk of a lot of complications to the healing process. Not all, though. Some of this still applies. You do still see this in wound care for immunocompromised and diabetic people. In fact, I found a YouTube channel which gives you like step-by-step instructions. If you're into grossness, you too can find it. At any rate, here we go. So this is a view of the surface of skin as it's being injured, and then next to each image we have a drawing of what's going on a cellular level inside the wound tissue during this part of the process. This is taken from Mino's Man in the Wound in the Ancient World. which is a great book, and I think it's available on Project Muse as a free ebook now. I'll try to remember to put this in the unit notes for those of you who are really into this. It's nice because it doesn't just do ancient Mediterranean. It's got ancient India, ancient China. I think it's got some Mesoamerican stuff in it too. So it's a just fantastic book and still a go-to. So we begin with the first step in your skin's process to healing a wound, and that is the formation of a scab. So the epidermis here is the unbroken skin. The scab forms out of dried blood and blood parts over the top of the wounded surface of the skin. And in this first stage, that's all you've got is just scab, broken tissue. And as part of this process, fibroblasts inside your skin are activated and begin to grow. So a fibroblast is fibro, like fiber, blast is from the Greek root for to grow. These are skin cells that, when activated, form long tendrils that interlace and then contract. And it's the action of these cells that's going to inform and drive the healing process from here on out. And they're really important because they're why scar tissue isn't like unbroken, healthy tissue. Scar tissue is thicker and it's scrunched up, and that's because of the fibroblasts. This becomes really critical when you have wounds that affect large parts of your body or parts of your skin that are in high stretch areas like the neck. Burns around the neck are particularly devastating because the scar tissue's contraction, it can be so tight that it reduces your range of motion because your skin is too tight for your head to move properly. And it can pull on your facial structures because you have effectively holes in your face, so your sensory organs can function. And that pulling can cause pressure on those areas. That's some of what Kelsas is going to start taking steps in remedying. Okay. Step 2 in a pre-antibiotic situation is pus. I mean, even today, we know what pus is. We've all had pus. At least I'd assume. If you haven't had pus, that's interesting. Not all pus is equal. It all depends on what microbes are growing in that pus. And although there isn't germ theory in antiquity, they do recognize that some kinds of pus are what they call good or noble pus, and some kinds of pus aren't so great. Now, this may sound horrifying at first, but they're kind of onto something, because certain kinds of more benign bacteria, if they grow in pus tissue, pus, by the way, is the remains of your immune cells and the microbes that they've eaten and destroyed. So it's a sign that your immune system is on, it's working, it's doing what it's supposed to do. But it's also evidence that bacteria and perhaps other microbes are in your wound and doing shenanigans. At any rate, these good or noble pusses create a bacterial overgrowth that competes with other microbes. So because it's present, it can keep worse bacteria from growing, like for instance, the microbes that create gas gangrene. This doesn't mean necessarily that it's benign or happy pus, like pus is not great. We try not to have it. But pus qua pus isn't always as horrible as it sounds. And in fact, modern pharmacy now uses this principle to create certain wound care items. For instance, mupirocin, which is an ointment that is prescription only for wound care, works on this principle. It's a culture of a harmless bacteria that outcompetes other microbes in your wound and then keeps it clean and enables it to heal. So this is, it's great. if you know which microbe is in there. And that's the key. Like, now that we have germ theory and microscopes and we can figure out which microbe is in the wound, we can control this a little bit better if we need to, which we may have to as antibiotic resistance gets to be more and more of a problem. But yeah, in an ancient context, they would identify good pus by looking for kind of a whitish greenish color, which tracks. Benign pusses tend to be this sort of chartreuse, like a very pastel pea kind of color. Pea is in like the vegetable, not pea like pea. Um, what else did I want to say there? Yeah, no. On a cellular level, the fibroblasts are starting to grow. You have various kinds of immune cells going after the bacteria. So once this process is cleared, you create granulation tissue. So granulation tissue is when the edges of the fibroblasts, these little fibers coming out of either end, have twisted around each other and have started to pull together. So a little bit like, like two fingers coming together, and then as my fingers kink up, that pulls my hands together. So that's what a fibroblast is doing. And this creates granulation tissue, which is about what it sounds like. It looks grainy, there are little lumps in it, and it's tight and puckered. So this is why scars look extra red and extra bunchy when they're in this initial stage of healing, like after the pus, once the scab is off, as it well, not quite is. This is when the granulation tissue is first developing. So the scab is still going to be there, but if, say, you're prone to picking at your wounds, you might have noticed that as you pick at your scabs, you'll start to see kind of like this granular tissue. This continues to contract until eventually the scab crumples. And this is why in a healing wound with a scab on it, often the scab will fall off, but it'll still bleed and form a second scab underneath that. It's because your skin is pulling together and it's squishing the original scab. But this pull together allows your healthy tissue to meet back up against other healthy tissue again and to close that gap as skin cells in the epidermis layer move to cover where that granulated scar tissue is. If all goes well, you end up with an area where your epidermis is a little thinner, the underlying tissue is a little thicker. That's your basic scar. By now you all have one. Because this process is driven by fibrous tissue that's pulling skin together at a constant rate, and because this is moving from the edges of the wound in, different wound shapes heal better than other wound shapes. For instance, if a wound is originally a missing square piece of skin, each edge of the square is creating fibroblasts, and the fibroblasts are the same. Like, the skin doesn't know if it's on the middle or a corner piece. And as the skin begins to pull together at a constant rate, what happens is on the areas where there's nothing to block the movement forward, the skin moves at a faster rate. On the edges, the fibroblasts tend to get into each other's way and cause gaps and slowdowns. So what you end up with is an X-shaped scar from a square wound, because the edges will first resist coming together, but then they'll seal, and once they've sealed, they stop forming fibroblasts. But in here, it's still forming fibroblasts, so the healing moves this way from the outside in, thus creating the star shape. Similarly, with a rectangle, you end up with this kind of long double Y-shaped thing. because again, the corners are going to close separately, and then the long edges are going to move more quickly and form more tissue as it tries to close. A triangular wound is going to close in a little triangular caltrop shape. But circular wounds heal very poorly because every edge of a circular wound is equidistant from the other edge of the circular wound, so there is no corner to heal up and create anchor points. So at a certain point, here I'm just going to draw a circle. It's going to be very bad, but just go with it. So if, switch to my yellow for this. So if cells are growing at an equal rate from all edges of the circle, eventually they're going to start crowding as they move inwards because it's the same number of cells on each edge of the wound, yeah? And they're going to start running out of space, and often they'll do it before they've gotten to the center. So you may end up with an open area here in the middle that will then form an ulcer. That is an open area of skin that's prone to infection, that never really quite closes because the skin has formed this ring structure around the edge. So often we find in pre-modern surgery, and still sometimes this will be a part of wound care, the edges will be trimmed into a rectangular or square or star-shaped structure in order to create a more neat closure. This will be a regular part of, say, removing cysts from underneath the surface of the skin. Part of what you want to do is trim off the thin edges into a shape that's going to promote even healing into a continuous surface. So the too long didn't read version of this is that circles are bad. Circular wounds don't heal right. You want edges in your wounds, no circles. Punches, it's bad. Good for biopsies, bad for healing. Hey, little buddy's helping. Nap time is over. Let's talk about wound healing and complications. Okay. Now, I've been talking about how healing works if everything goes well. That's the ancient world, though, yeah? Not everything goes well. So here are some of the most common problems with wounds, and they're very relevant for the history of surgery because ancient surgeons never quite knew which procedure would end this way. And lest we forget the cautionary tale provided by Khal Drogo, even an uncomplicated scratch can eventually end in sepsis and death. Sepsis, for those of you who don't recall, is blood poisoning. That's when a bacterial or any kind of infectious agent gets directly into your bloodstream. It's not good. You go into shock, you die. It's bad. All right. So the fresh, uncomplicated wound is up there for comparison's sake. And we're going to go down, left, right, left, right, left, right. And these are labeled for your reference later. Okay. One of the least problematic, but still a bit of a problem, especially in an ancient context, complications of a wound healing, is erysipelas. This doesn't necessarily happen with an obvious wound, but it's pretty common. This is when, oh, okay, he's noping out. Relatable. Here you go. Go play with your kitty. The skin reddens around the wound and puffs up a little bit as your body starts sending more and more interventions to the area. Improved circulation is meant to aid the healing process and the immune response around the wound. This can resolve on its own, but it's usually a sign that you need to clean the wound a little bit more aggressively. The next phase is suppuration. You've probably seen this, you have, because it was mentioned a few times in the Hippocratic Corpus. It's in the course glossary. Suppuration is when infected matter is being produced enough to drip from the wound. So this is a buildup of pus sufficient to create leakage. It's also not a good sign. Even if it's good pus, you want this to stop eventually. And it's not ideal, nor is it destiny either. Sometimes you don't get pus. Next up, and more alarming, is deep inflammation. So here you can see that not only is the skin around the wound swollen, but the limb also. So this means that the infection that had been causing the suppuration and the erysipelas has breached the borders, so to speak, that it has traveled inside the body, it's past the line of defenses of the various immune cells that have come to the infection to fight off the agents in the broken skin, and that it is starting to do damage in tissues that had not been wounded. And this is the kind of finding that your ancient authors will describe as inflammation, not infection, because in order to have the term infection, you need to know that there's an agent that is growing in the wound, and for that you need germ theory, and we're not in that universe. So your authors will call this inflammation, because that's what they can see. Inflammation just means it's puffing up. But we now know that it's puffing up because infection. After that, we've got a bit of a choose your own adventure situation. Deep infection can lead to a spreading ulcer. So an ulcer is when an infection begins to eat away at healthy tissue. So it's no longer that the open skin is confined to the original wound, but the edges of the original wound begin to be eaten away by the spread of the infection. This can go into deeper tissue. This eats in 3D, so it'll start removing formerly healthy skin, it'll go deeper into the tissue, it'll eat through fat, muscle. Eventually an ulcer can get into the bone, and that can be just devastating because bone tissue is very difficult to treat for infection. Because bone is so hard, it's so full of holes, and it's this wonderful honeycomb for bacteria to hang out in and throw a party. Once it's in the bone, it has a tendency to fester. Now, this doesn't necessarily mean your patient is going to die. Sometimes the ulcer stabilizes and then it just sticks around for years and years and years. Henry VIII famously had one in his lower leg, likely as a consequence from wearing his garters too tight. He was in a time where it was considered really, really sexy to have nice calves. And in order to emphasize his hot calves, he would wear his under-the-knee garters really tight. This led to varicose veins. One of them eventually burst, created an ulcer. The ulcer went to the bone and eventually created this long-term ulcer situation. Ulcers, because they're full of bacteria, they stink. Yeah, they're very icky. Thank you, Jimmy. And they're uncomfortable, and they hurt. They're just horrible, and they make you miserable. Henry VIII was fairly miserable by the end. So were his wives. Next up, we have granulation tissue, sometimes called proud flesh. So this is when your fibroblasts get way too enthusiastic. There are too many of them. They get really keen on closing that wound, and they just keep multiplying until they take over the wound, and then you end up with this raised, sort of spongy looking tissue. it looks a lot like a tongue. It's that kind of texture, like the surface of your tongue, only it'll be coming out of a wound. You can look it up on the internet if you're super interested. It's unsightly. It's not all that dangerous, but if you ever want the skin to close over it, you need to shut that process down a little bit. And here is where it gets uncomfortable, because you have to debride that tissue. So you have to physically remove that excess proud flesh, the granulation tissue, by cutting, by scraping, by sanding, some combination of the above. And it's really gnarly. Thank goodness we have topical anesthetics now. But in antiquity, you'd be doing this to a patient who could feel it and be just super painful and unpleasant. But the worst, the absolute worst, is gangrene. There are a few different microbes that lead to gangrene. Gangrene is when so much of the tissue dies as a response to the infection process that the limb cannot survive any longer. But then as, say, the fingers and the extremities die, they're still attached to your circulatory system. So now gunk and glurge from your dead, infected, pathogen-laden flesh circulates into your bloodstream, and if it hits your central circulatory system, it can infect your heart. Depending on the pathogen, it can make you incredibly sick, and you just die horribly. Once this process starts, you must remove the limb. Even today, you can try to cut away the dead tissue and hope that the healing process will start to take over, but you cannot leave dead tissue on a wound for this reason, because the dead tissue will create a reservoir where rotting flesh and the bacteria that's feeding off of it flushes back into your healthy living body and eventually kills the rest of you. This is the situation in which amputation is called for. Now, in the Civil War, regularly, if they thought a wound was likely to turn to gangrene, they would do preemptive amputations for just this reason. Because if you wait until the gangrene is super noticeable, then you're in a pickle. Because you might not be able to cut off enough of the limb, because that bacteria isn't just in the black part of the limb, it's spread backward from the wound. So you need to cut off a good margin of healthy tissue. In the same way, when you're excising a tumor, you need to make sure that your margins remove all of the cancerous cells. If you don't cut off enough limb, you might have to cut off more limb and more limb and more limb, and eventually end up losing even more limb. In an ancient context, when you don't have a good enough knowledge of circulation to control the bleeding, this isn't going to have great outcomes. Now, people did survive amputations, but amputations were incredibly risky. They had to be done very, very quickly. And in a procedure that Celsus describes at one point, involves cutting through the tissue, pulling it back a little bit. You want to cut the bone deeper than the tissue so that you have a lot of loose tissue to wrap around the stump. And then you have to hope that you don't create an infection pocket inside of that amputation space. You also need to make sure you tie off all of the blood vessels that might bleed. It's just it's a risky proposition, but we do have skeletons surviving from the ancient world with apparent amputation injuries. Hi. Would you like to say hi? I'll pop your little face around here. Yay! So some people lived. It's a happy ending. Hi. Hi. Yes. Hi. Yes, we'll do brown bear next. Yeah. So about abscesses then. I've mentioned them. So let's look at some. Abscesses are one of the most common pathological conditions that you're going to use surgical interventions to deal with. An abscess happens when bacteria enter the skin through an open wound or some kind of a break. They can also go down a natural structure like a hair follicle or an oil pore. Those of you who have had abscesses secondary to acne know all about this, but usually this is something that happens with either a break in the skin, very rarely, but not unheard of. This can happen when there's significant damage to the tissue underneath the surface of the skin, so say a bruise that ends up destroying enough tissue that you have a pocket of dead flesh, and then that dead flesh gets enough bacteria in it that an infection can start going. Either way, you end up with a pus that is pocketed underneath the surface of the skin and the flesh. This can happen in any part of your body, though. And then the body, through its own processes, tries to find an outlet to drain that pus. So again, the pus is a mixture of your own immune cells, dead skin cells, dead tissue, and pathogens. Depending on what pathogen, this can be very, very good or very, very bad. Your body is going to try to create a wall around that pus. If it succeeds, we call that a cyst. The word cyst is from the Greek word for a treasure chest. The treasure is pus. Lovely. So the cyst structure keeps the pus from doing what you hope it doesn't do. Namely, if it doesn't get walled off in time, the pus will seep into surrounding tissues and the infection will spread, the abscess will get bigger, more tissue will die, and you'll end up having an under the skin infection situation. In fact, this is how erysipelas spreads into inflammation and then finally into gangrene. It's bad. You want to deal with this right up. Today we have antibiotics, but we also still drain abscesses. However, we're starting to rethink that a bit, because if you properly clean an abscessed wound, you don't necessarily need antibiotics to control it. And as we start to think more about antibiotic resistance and about putting group health into the equation as we're thinking about outcomes and best practices, we're starting to lean more into sustainable practices like thorough wound cleaning and wound care. So we used to be like, those Romans, idiots. If only they had antibiotics. And yes, antibiotics are fantastic. I'm not saying otherwise. I'm so glad they still work sometimes. But this is not an ineffective intervention. And it's something that your body will try to do on its own. The skin over top of an abscess will destabilize and the pus will be able to push its way out, and sometimes it'll drain itself. Infrequently, the entire thing will resolve on its own without intervention, but most of the time you do need to have surgical intervention to speed up this process and ensure that you don't just have a space that continues to produce pus. Especially with cysts, that wall that your body formed to keep the pus from spreading is going to continue to create a trap pocket. It's going to shed epithelial cells, which will feed your immune cells and produce more pus. Surgically then, you want to cut into the abscess very carefully because you don't want your cuts to spread the infection. But you open it and then you clean the inside of the wound, including removing the pockets that have been formed inside the tissue. So this image I've given you, this rather horrifying image of skin with a drained abscess. So this is an abscess that's formed ahead, it's drained on its own naturally, but when you look down into the depths, you see all these pockets. That's not good, because those pockets can refill. The skin hasn't formed a proper seal over top of itself. So what we would do for that today and in antiquity is we would cut around it, we would remove it all the way down to the healthy flesh, and then through a combination of suture closure and careful wound cleaning. Often we leave that open just so the bacteria doesn't have a chance to form another pus pocket, because if you close it while it's still dirty, you're going to just make another abscess. Only it's going to be bigger and nastier, and it might turn into a systemic infection again. So instead, often this will either be left partially open with a wick or a drain, or it will be closed, but there are wound care things you can do to flush out the area under the wound while it's healing to make sure that all of the infected matter is gone. In antiquity, that would be a combination of vinegar, honey, aged olive oil, and that would have been pretty darn effective. This is what I mean by a drain. This is done with the tin pipe. This went away for a while, which is a bit sad, but this is Greco-Roman medicine, and in Greco-Roman medicine, these little pipes to drain wounds were possible. Bronze more often than tin, although we have found some tin ones for the reasons we use bronze in other things. It's just a great material for this. Sometimes we also see silver drains. Sometimes too, they'll use a piece of linen thread, which will act as a wick. It will pull from the damp area of the string to the dry area of the string all of the gunk that's inside of the wound, and if you carefully pack and clean, you can use this to help encourage the wound to drain properly, and this will allow you to close part of the wound while still allowing for drainage, which is the idea here. You tie a little piece of string around it so it doesn't get lost back in the wound as the flesh swells and bends and moves. The other thing is your patient isn't going to stay still, so you need to design your interventions with a wiggler in mind. This brings me to one of the cooler and more interesting things from this unit, namely fibula pins. I've talked about suturing, and this is a major mainstream way for closing wounds, but as I mentioned, it's got some problems. If you need to take stitches out, you need to take them all out. It can irritate the skin further. It causes a lot of issues. And ancient Mediterranean folks had a solution to this: fibulae. These were available for all of the time period span we're discussing here. And the picture on the right has some examples of what these looked like in that period. The illustration is from a surgical manual in the 1850s. This never went out of style. This was a major wound closure strategy that's been replaced recently by surgical staples. This is similar to surgical staples in that it makes use of metal's property for not sticking to skin as much and providing a sliding closure. But it's a little bit better than that even, because the pins are stuck through either end of the wound, much like sutures, but then the string is wrapped around the pins in a pattern like the one we're looking at now that can be tightened or loosened as the wound heals. So as the wound swells, you can loosen the stitches, you can loosen it a couple of times a day as part of your cleaning. You can use it to release the stitches a bit, press on the wound, clear out the pus, and then retighten and continue without removing the pins from the wound entirely. And then as it heals, you can continue to hitch up the knots until you're finally ready to remove first the thread and then the pins. And when the pins move out, they're just a little pinprick in the skin, leaving you with a smoother wound surface. In surgical context, these were regularly made out of silver or bronze again, which has the added function of putting silver and bronze directly on the wound. In metal form now, this will keep overgrowth from touching near where the fibula pins are, but in combination with metal salts and metal compounds, you could create a pretty effective wound cleaning treatment, and you could balance the needs of closing the wound and cleaning the wound in a way that doesn't re-traumatize the patient. This is freaking awesome. And if you want to bring something back from the ancient world, do this with my blessing. Maybe don't try it at home, but if you do, I will totally count it as a project. But only if you know what you're doing with wound care. I'd go to a doctor myself. Yes, I do have pictures of the sturgeon bladder used to derive surgical glue. Uh, there's the bladder. That's what the glue looks like when it's being rendered. You have to cook it a little bit to remove the moisture, but you end up with a functional both skin and bone glue. It's a little bit flexible. Isinglass, the compound found in sturgeon glue, was also used before plastics were available to create clear, rainproof curtains for carriages. It's like the precursor of glass in automobiles, and it was safer because it didn't break into tiny pieces of glass when you ran into things. And here we have the bandaging process. This is something that has changed a little bit in the last 50 years with the introduction of elastic fabrics. Things like spandex and ace wraps really changed the way that we do therapeutic bindings. We've talked about these as a drug delivery mechanism for wound cleanliness, but they're also a way to stabilize bones and torn muscles and ligaments, and also surface cuts in a way that doesn't require suturing and can take pressure off of sutures. In the ancient world, being able to wrap properly was a really critical factor in your outcomes for both wound care and bone setting, especially since there weren't a lot of great ways to immobilize the joint using things like casting material. There's no fiberglass or plaster of Paris. So instead, they're taking advantage of a property of fabric called the bias. If you have a woven suit shirt, not like a stretchy woven suit shirt, like regular woven cloth, if you pull it straight on the grain, like from collar to tail, it's not going to stretch that much. But if you move your hands to an angle where you're pulling like armpit to belly button, then the cloth is going to stretch a lot. That's the bias. And look at the way this cloth is being wound on Patroclus's arm. This is Achilles binding up Patroclus's wounds in the middle of the Trojan War. They're so cute. So here's the grain of the bandage. This is the direction that doesn't stretch at all. And then the bias line is running this way, so that the bulge of the arm is going to be where the fabric stretches, so that it's going to be firm. It's going to hold that arm steady so that the cut seals, that if there's bone involvement, the bone is stabilized, but it's not going to be so tight that you're going to lose circulation. Wrapping bandages is something that you used to be trained to do in med school. As late as the 70s, when my parents went to med school, they were still being trained how to use non-stretch bandages. But this has changed. We no longer have as much of a need for this, at least not yet. But should you be in an emergency situation and you don't want to go to the ER, use this in good health. I hope it works out for you. Yes. I do want to warn you, there's going to be eyeball stuff on the next slide. So if you need to like take a minute to prepare for the eyeball stuff, now's the time. Okay, you ready? 3, 2, 1. Eyeball. Hemorrhoids! Lovely. I have not asked you to read it, but if you want to, there's a Hippocratic treatise on hemorrhoids, which makes for just some delightful bathroom reading. Poor Mr. Spouse. Sitting over here in his chair. Wait a minute. That's the couch. Okay, sorry. Yeah, I got him. Okay, there's Mr. Spouse, despairing.
Just wait till they hear how they treated them. Just tell them.
Oh, yeah. Okay,
Tell them.
I will tell them about it. Right. It's nice I have an audience back. It's lovely. We are looking here at a pair of forceps and a cautery iron. But first, I need to explain what hemorrhoids are, because I don't want to assume you know. I didn't until I was old enough to Google them. Hemorrhoids occur when venous structures around the rectum become strained and damaged. The walls of veins are not particularly tough, and they can bulge, especially if there's pressure on the areas. Blood will then pool in those bulges, and it'll create these very painful, itchy nodules that can sometimes bleed when the walls are worn through, and that collected blood kind of seeps out. So, an advanced hemorrhoid, you'll notice blood when you wipe. It'll be very painful, but also like exquisitely itchy, very unpleasant. Uh, they can happen and often do happen near the surface of the anus, so that they tend to be closer to the external areas, but you also get them further up in the rectum. They tend to congregate around the sphincter because that's where the highest amount of pressure is, and you'd get more of them the harder your bowel movements are. So a very constipated person with very rocky bowel movements is going to produce more hemorrhoids. But also, if there's more pressure on your rectum, due to other structures in your abdomen, the way that you're sitting, the amount of time you're spending straining on the toilet seat can also do it. Also, rowing for long periods of time on trireme benches, interestingly. This was a problem that plagued Greek sailors for most of the Hippocratic period. Hence the Hippocratic treatise. Now, Hippocratic authors treated hemorrhoids very aggressively by our standards. Poor Mr. Spouse. That is, they would either ligate them with a piece of thread, that is, like tie them off. This would cause the ligated bit to fall off, and then hopefully the vein wall would heal in such a way that eliminated the hemorrhoid. Or they would use cauterization, so they would burn them off. Now, we still do hemorrhoid surgery for extreme cases of hemorrhoids, but in general, it's better to soften the bowel movements and let them go away on their own. Uh, Cautery can often backfire and create open ulcers, which can lead to infections and complications, which brings me to the next slide in this horror show. Fistulas. A fistula happens when an abscess drains in such a way that it creates a hole between one anatomical structure and another anatomical structure. You don't necessarily need to have an infection for one of these to form. If you have pierced ears, you've effectively induced a fistula in your earlobe by putting metal into your earlobe until the skin healed in an open passageway. So that's a fistula. This can happen when an abscess finds a path to drain through, and it happens through the same mechanism that creates cysts. Yeah, just like your body will try to create a wall around the infected abscess, your body will try to create a wall around where the pus is traveling. And even after that infection has drained, that passageway is going to remain because your body has healed it into a new opening. Now, this can happen as a complication of, say, a botched hemorrhoid surgery or chronic constipation. So this is something that everybody can get somewhere. This can happen as a response to trauma, too. Often, if you've had a blunt force injury that does enough traumatic damage to your tissue, and that tissue dies, and then your body successfully removes the tissue without forming a massive infection, in its place, it'll leave a fistula. There was a case of a guy in the 1800s, I think his name was, no, Phineas Gage was the railroad spike in the head dude. There was another fellow who had a fistula from getting shot in the stomach, where his stomach healed in such a way that there was an open hole through his abdomen, and there was this doctor who kind of took him on as a long-term study subject slash creepy pet and used his stomach fistula as a way to study digestion. I was nuts, but it's the 1800s and outside of my jurisdiction, folks. But oh, the 1800s were a wonderful time for surgery, weren't they? So this most commonly now in the developing world particularly happens in women as a complication of childbirth. Because childbirth does all of these things that I was just talking about. It can create prolonged damaging pressure to your internal organs because there's a heavy object passing through a narrow space, putting prolonged pressure on structures that have to be fed by blood supply. And if you're straining to deliver for days on end, that pressure can cause the areas where the baby is pressing on your abdominal organs to die and degrade, and then your body will try to heal around those missing structures and create a fistula. These fistula can happen between the bowel and the uterus, or the bowel and the vagina, or the vagina and the bladder, or all of the above. And this causes really difficult and dangerous living conditions because people with vaginas cannot control the flow of material out of the vaginal space. So if you have a hole between your bowel or your bladder and your vagina, that liquid and poo will leak into your vaginal space and then out. So it causes chronic incontinence, both urinary and bowel incontinence with odor and secondary infections because your vagina should not have either of these things in it. And this causes extreme social stigma, which is even more sad when you realize that this disproportionately affects women who have babies very early. Fistula secondary to childbirth happen in women who begin childbearing as soon as they are physically capable of conception. So this is girls who are having babies at 11, 12, 13, 14 years old, but really the 11 through 13 range is prime territory for forming obstetrical fistulae. And this is often in areas where access to medicine is very sporadic and also less accessible by gender. So the fact that they're women and young, and many of them child brides, means that we're talking about a situation in which fistulas ruin lives. And I bring this up because this is the situation we're talking about in the ancient Mediterranean. The ancient Mediterranean is also a world in which child brides are normalized. Again, over 14 seems to be typical, but there is a regular minority who are marrying at 10, 11, 12, 13. The fact that Cyrannus has to have a whole argument with his audience saying, hey, wait, look, 12 is too young, like 14 is a good age, and that's his negotiation point, tells you something about what having babies for the first time in the ancient world looks like. So when we think about the experiences of ancient women and fistula repair, all of this needs to be in our headspace. This slide could be a lot more depressing. I am not going to talk about the history of fistula repair in the 1800s, but it is super, super depressing and like really angry making. But let's talk about the solution, yes? Interestingly, this is the fistula repair procedure that gets discovered in the 1800s, almost move for move, it's about the same. Celsus suggests that you take a linen string, a very rough spun linen string, and then you pass it from one end of the fistula to the other after you've used a probe to figure out where the tract of the fistula is. And then you create a bougie that is a continuous loop. And I'm going to show you this procedure on the next slide. I hope I remembered this right. I did! Sorry, not a bougie, a seton. Wrong term, sorry. A seton is a loop of surgical twine, linen in Kelsis's case, that's been tied in a knot, and you just pull it back and forth over and over at different angles. And then this movement of the seton against the walls of the fistula re-injures the tissue. It scrapes off all of the scar tissue that has created the fistula, and it does for the fistula what you do for a cut when you trim off the edges in order to create a new suture line, like we were talking about back at the beginning of the lecture. In this case, the seton reopens the fistula tract, pressure is applied, and with luck, the tissue will heal back together and the fistula will be repaired. The one we're looking at now is a perianal fistula. So this is the kind you would get if your hemorrhoid cauterization goes awry, including the perianal abscess, showing how the fistula forms, and then the repair is here on the left-hand side. There's a bit of good news here. Fistula repair is possible in the ancient world, so long as it's not too large and the linen is with you.